Welcome to VidZet. I'm Dr. Ted Noel. Today we're going to talk about the lies the left is telling about Obamacare as we look to get rid of this abomination. Supposedly, Obamacare has 20 million people on it who would not otherwise have insurance. That 20 million number has been examined very carefully by the Heritage Foundation, and they found that the real number is 14 million. The problem is 11.8 million are actually on Medicaid, which isn't even Obamacare at all. That only leaves 2.2 million new coverage from Obamacare. Now, if we break that down, we actually find that there are 9.8 million people on Obamacare plans, but out of those, 7.6 million people were kicked off of employer plans because of various things that happen in Obamacare. Many employers ran into serious cost problems. The healthcare deductible under Obamacare went up. Premiums went up. And then you had a problem where a growing business suddenly finds itself unable to grow anymore because once you get over 50 employees, you suddenly have a new expense dropped on you. You have to add another $16,000, $18,000, $20,000 a year for health insurance on top of a raise for a new employee. So what they have to do then is to hire part-time employees. They have to keep them under 30 hours a week. And that means that people who want to get full-time work are stuck in part-time work. On top of that, Obamacare stole $700 billion from Medicare. Then it rewarded hospitals for not spending money on seniors. So now you've got skimpy care, and you have a number of seniors who have died waiting to have angioplasties for their coronary artery disease because of Obamacare's cuts. Another lie you're going to hear is that if we get rid of Obamacare, people won't be able to see a doctor when they need to. But Obamacare deductibles, according to the New York Times in 2015, that's not even this last year, it was the year before, the deductibles were up to $6,000 in the typical bronze plan, which the lower income voter could afford. That meant that they had to pay out of pocket for all of their basic health care. Put bluntly, having insurance did them no good whatever. Of course, the claim had been that Obamacare would improve health for people who were on its insurance program. However, we find that the exact opposite is the truth. The Oregon Health experiment showed very clearly that when people have insurance, we see more emergency room visits, we see more doctor visits, we see more cost, but there is no measurable effect of improved health. In other words, insurance doesn't help. So losing insurance won't hurt anyone. The next lie is that people with pre-existing conditions will die if Obamacare goes away. That is pure and simple false. 35 states had solutions to this long before Obamacare was even thought of. Basically what they do is they take these sick patients and they move them into what are called high-risk pools. They're subsidized and managed by the state. It reduces cost for everybody, and it improves care for those people who are in trouble. So the solution is there, and it didn't need a massive government fix. The current amount of money that Obamacare is spending on subsidies, and remember, these subsidies aren't taking care of the deductibles. They're just taking care of premiums. The current amount is $43 billion a year. But we know that for these very vulnerable people in the high-risk pools, it could be done for $16 billion. That's 37% of the cost of Obamacare. So Obamacare is a bad deal on this one. Finally, there is an argument that disabled people will lose care. Once again, it's a lie. The fact is that 500,000 people are on waiting lists because of Obamacare, not because it helps them. It makes it worse. Obamacare gives states more money to take care of healthy people than to take care of sick people. And as a result, sick people find that their care is delayed, and care that is delayed is care denied. We need to stop it completely. I'm Dr. Ted Noel. Thanks for watching.